Excellencies, dear colleagues and friends, good afternoon and thank you for the opportunity of saying a few words today. The COVID-19 pandemic is a tragic and powerful demonstration of the importance of innovation and access for public health. Since the earliest days of the outbreak, science and innovation have been at the forefront of the response. The viral genome was sequenced in record time, enabling the rapid development of tests and driving research on vaccines and therapeutics. Less than 8 months into the pandemic, more than 200 vaccine candidates are in development and more than 20 have started human trials. Already we know that one drug, dexamethasone, can help patients with severe disease. And we know that two other therapeutics, hydroxychloroquine and lopinavir, ritonavir, offer little or no benefit. More than 5,500 patients in more than 20 countries have joined WHO Solidarity Trial, which will help answer questions about which treatments are most effective. But innovation is only part of the answer to this pandemic. Together, we must all ensure that all people have access to the fruits of innovation. We must make sure that vaccines, diagnostics, and therapeutics for COVID-19 are global public goods, not more reasons that more people are left behind. That's why WHO has worked with the European Commission and other partners to launch the Access to COVID-19 Tools Accelerator to speed up the development, production, and equitable distribution of vaccines, diagnostics, and therapeutics. To complement the ACT Accelerator, we also launched the COVID-19 Technology Access Pool, which will provide a one-stop shop for scientific knowledge, data, and intellectual property on the virus to be shared equitably by the global community. I would like to use this opportunity to thank the President of Costa Rica for this initiative. Both initiatives support the historic World Health Assembly resolution on the COVID-19 response, which calls for the urgent removal of unjustified obstacles consistent with the provisions of relevant international treaties, including the provisions of TRIPS agreement and the flexibilities within the Doha Declaration. The WHO Global Strategy and Plan of Action on Public Health, Innovation, and Intellectual Property also encourages the application and management of intellectual property to maximize both innovation and access. But innovation and access are not only essential for COVID-19, they are essential for every aspect of public health. That's why the study we're launching today is so important. It brings together our shared expertise to offer a wealth of technical information and practical experience at the intersection of health, intellectual property, and trade. This second edition features significant innovations and challenges, including the 90-90-90 goals for HIV treatment coverage, new opportunities to massively expand screening and cure of hepatitis C, as well as ensuring access to vaccines, insulin, and treatments for tuberculosis and cancer. These case studies illustrate the continuing gaps in access to health technologies, medical devices, and diagnostics. Barriers to access must be removed, including unaffordable prices, intellectual property barriers, unjustified tariffs, and challenges in ensuring effective and efficient regulatory review. This updated report outlines the numerous achievements made through innovative, collaborative models of drug development, including new models and investment initiatives for research and development. It also describes approaches that governments are taking in cost containment, procurement, intellectual property management, selection of priority health technologies, competition law, and trade policy. However, while investments in R&D for neglected diseases have increased, a large gap remains to meet the investments needed to develop effective treatments for the estimated 2 billion people affected by this disease every year. Similar research gaps exist for new antibiotics, tuberculosis treatments, pediatric medicines, and other areas. We have seen over the past months how countries have mobilized unprecedented investments in collaborative, not-for-profit research and development. The pandemic is showing what we can do when we come together to face a shared global health threat. That's the kind of collaboration that can save lives and transform the health of billions of people globally. WHO is committed to working with our partners at WIPO and WTO to harness the power of innovation to increase access to the tools to build a healthier, safer, fairer world for everyone, everywhere. I thank you.